my name is Mary Monsivais, and this is going to be my research project for 4308 at UHCL with Dr. Eminent. This project will be covering our air squat. Today we are discussing air squats. So we will demonstrate the proper way to air squat and the benefits of why we would use this exercise in our future program. We will discuss indications as well as contraindications for our exercise. We are also going to see where the exercise falls in our Gentiles taxonomy chart of motor skills. The muscles that are included in this exercise, it is the glutes, the hip flexors, the hamstrings, calves, quads, and core. Incorporating air squats into our future programs, we are allowing future athletes to have a proper foundation for those who want to pursue a higher level of training. For example, back squats, front squats, overhead squats. Also, air squats are the key to Olympic lifts. So anybody that wants to pursue Olympic lifts would need to know how to properly air squat in order to get to that level of difficulty. Already many athletes who will not reach their full potential because they don't know how to air squat properly. So because they don't know how to air squat properly, they just never reach their full potential. This exercise is specifically for those who are in a sport who wants to see athletic development, that wants to use powerful hip extensions, it wants to see improvement in balance and just overall improvement in their athleticism. We want to make sure that if we incorporate this into our program, that it falls in line with the progression of the athlete. While researching, I came across an article called The Back Squat, a proposed assessment of functional deficits and technical factors that limit performance. And it begins to go into detail about how an improper technique can really hinder an athletic performance. Athletes with proper technique can increase muscle mass, strength, speed, and increase the full range of motion. The air squat is essential to human movement, a proven performance enhancer, and a gateway movement to the best exercise in strength and conditioning. If our clients are trying to perform advanced movements without having the proper technique, it increases their chance of injury, delays advancements, and also delays the progress that they want to see back. It also stunts the client's rate of return on their efforts. Being able to properly air squat will allow them to advance faster throughout their other aspects of their training, and with them continuing to improve, it will make us look good and make us look more professional and more experienced. Now we want to make sure that our athlete is able to air squat properly. So we make sure that they're standing with their feet a bit wider than your shoulders, toes turned out about 45 degrees. Reach your arms forward and lower your butt down past your knees. As you keep your weight back over your heels, you should be able to wiggle your toes, a sign that your weight is in your heels. Chest up, eyes forward during the movement. Make sure your athlete maintains a braced core and make sure the spine is neutral. Bring your hands down to your side as you stand in the full upright position with the hips and knees extended. And you can repeat. The common faults during this exercise is loss of contact between the heel and the ground, outward rotation of the feet during the performance of the squat, lack of squat depth, and improper lateral tracking of the knees. If their knees begin to cave during the squat, place a looped resistant band just above their knee and consciously drive them out against the band. This will engage the hip abductor muscles to train the correct knee position and stability, which can help prevent knee pain. Where this exercise falls on the Gentiles taxonomy chart that I found would be box 3A, and the reason for this is because This is a body stability exercise that did not involve any other objects. It was regulatory conditions and there was no intertrial variability. What that means is that they're performing what that means is as they're performing this exercise, they're going to be doing the same motion over and over again for a set amount of sets. For a set amount of sets and reps, and they're not going to be using any type of object. If you did want to progress the exercise according to the chart, you can incorporate a medicine ball, so something like this, and have them throw it back to you as you are doing the exercise. But as we have the exercise here in our video, this is a 3A in motion regulatory conditions and no intertrial variability skill.